everyone. Okay, I'm going to start off by introducing you to a couple of cons of Obamacare and universal health care. There are higher tax rates with universal health care. They provide citizens, they're saying that it's going to regulate your health care. And that's a total myth because it doesn't regulate health care, it regulates your health insurance, and they're totally different things. Health care is the care provided to you by hospitals, pediatricians, doctors, etc. And health insurance is a method of paying for the health care. There's also medical device tax, which is a 2.3% excess tax on items having to do with medical devices that is supposed to help cover the cost of Obamacare's expansion of the healthcare system.
So, the Affordable Care Act was made to cut all unnecessary costs. Wouldn't that be regulated?
It can take different standpoints of people that you talk to. Everybody always says we want a cure for cancer or a cure for a certain disease, but medical device tax kills jobs and cures. This is obviously a wrong choice. Would you want a higher tax and more lives taken away, or a lower tax and more people battling and overcoming a disease? The U.S. is having a very hard time getting our unemployment rate down, all because Obamacare had to come in and mess it up for thousands of people. Not right now. Also, universal health care, or Obamacare, causes people living with poor conditions to have no responsibility for themselves. They're taking the taxpayers' money for their uses instead of getting up and getting work for their benefits. This is not fair to the taxpayers because they are being taken advantage of. I'm sure nobody in this room would want their taxes to go towards someone that is not working for the benefits of themselves. It is one thing to help someone in need, but it's another when all of your taxes are going towards people that have no responsibilities for themselves. There are also many Medicare payment cuts. Doctors are facing a 24% pay cut in both Medicare and Medicaid reimbursements. Network restrictions, plan changes, additional expenses, limited coverage area, and confusion are all cons to Medicare. I'm sure no American wants to have that much going on with their health care and that much confusion in their lives. There's also one last thing, employer mandate. Obamacare employer mandate forces all employers with more than 50 full-time employees, or those who work at least 30 hours a week, to provide health insurance for employees or pay a $2,000 penalty for each employee after the first 30 workers. This affects such a wide range of American employees. American workers already cannot afford the high price of Obamacare, and this is just the beginning. By 2017, we will have so many job losses in our country.